discuss certain cervical pathologies in your neck. As we described in our last episode, there's always concern if you have degenerative disc arthritic changes, it can lead to chronic pain in your neck, in the middle of your neck. And if you have compression of your nerves, you can have sciatica-like shooting pain, numbness, tingling going down the arms. Majority of these symptoms are treatable with non-surgical methods, typically with a combination of anti-inflammatories, steroids, muscle relaxants, physical therapy, chiropractor, and epidural steroid injections. About 60 to 70% of patients will get better without requiring surgery over a period of about 2 to 3 months. For those patients who have weakness in their arms or legs, where it limits their functional ability, their ability to eat, to dress themselves, to do their normal daily activities, those patients should have surgery on a more urgent basis. Patients who have severe pain, typically a 6 to 7 out of 10 on a day-to-day basis that affects your normal daily function, those patients should also have surgery on a more urgent basis. Otherwise, the majority of patients do tend to get better with non-surgical methods, depending on the exact pathology that is being addressed. The times of concern are patients who have significant spinal cord compression. And if you look at the spine model here, the big yellow bundle in the center is your spinal cord, and it's surrounded and protected by your bony spine. Over time, when you have arthritic changes, if you have compression of your spinal cord here, that can lead to severe symptoms of weakness, pain, loss of bladder bowel function, and so that needs to be treated on an urgent basis. Depending on that pathology, that can be treated usually via surgery from the front of your neck with an artificial disc replacement or more traditional cervical discectomy and fusion with screws and plates. Sometimes that issue can also be treated in the back of your neck with a decompression where you open up the back part of your bony spine to take pressure off your spinal cord. Sometimes that is incorporated with some screws and rods to provide additional stability to your spine if your spine is highly mobile and unstable. Other times that can be done with a motion preservation technique like a laminoplasty that will crack open half of the spine but still maintain your motion and function. And other times we can also perform an endoscopic minimally invasive surgery where we place a 7mm small tube down to the inside of your spine with a little camera. And if you have a small compressive disc herniation or compression of your nerves, we can open up space around that side, and that will alleviate your symptoms with really a minimal surgical approach. So these are some of our methods that we can use to treat patients with cervical pathology, and we'll be back to address your other surgical techniques next.